This is our June 10th, 2020 Economic Insights webcast. And the structure for today is I'm going to give just a really brief U.S. Kind of more of a macroeconomic update and some of the turning points and trends that we're kind of seeing right now. And as Katie mentioned, we have Dan White from Moody's Analytics with us today. I'll give him a more formal introduction in a minute, but he will be giving us kind of an analysis of some of the state budget issues and where that stands now. And then we'll have time at the end for some Q&A that Katie will moderate. So first of all, I just hope everyone is safe and healthy and doing all right out there. Just to kind of take a quick look back in April, we looked at when COVID-19 first infected the economy. In May, talked about the economy being in quicksand. And now we have this brief update that I want to give you. So hopefully everything is working here. Not letting me advance it yet. Let me try the enter button. There we go. Oops, now I went too far. All right, so here's an interesting chart from Moody's Analytics. And if you've been watching the news, you learned this week that the NBER Business Cycle Dating Committee, NBER is the National Bureau of Economic Research. They have a business cycle dating committee that is a group of 8 really distinguished economists that look at big trends in GDP and in industrial production and employment and just a number of things. And they mark the start and end of the recession. So they're the official arbiter of the peaks and troughs that we've talked about previously. Well, they made their declaration this week on Monday, I believe it was, that February was the peak month for the economy. So that would mean either that the recession began in February, I guess you could argue, or it began in March. And when I look at this, I would say that things were still going on pretty good in February, but it was in March, and really it was in early and mid-March that we saw the big downturn take place. And so I don't expect you to kind of read everything in this chart. The important thing is to kind of look as you scan it from left to right, as everything that is in the greenish area, really suddenly everything turns red in March, and we'll see that in the April numbers as well. A lot of folks are saying the recession's already over. That'll remain to be seen, particularly as it's going to take a while for employment to come back. But one of the big things that I've been talking about, that we talked about in the quicksand episode last time, was uncertainty. And I talked about some of the unintended consequences we could have. And so I found this chart, and I thought you'd like to see it. This covers my lifespan, and the world has never been in as great of uncertainty as it is now with the coronavirus, according to the statistics here put together by some of the economists that come out of Stanford. So that is kind of the word of the day, if you will. We've got this big cloud of uncertainty, and I want to break it down a little bit. Where are the main levels of uncertainty as we start to come out of this quagmire? What should we be looking at? Well, obviously we have the virus. How is it going to spread? Who is it targeting? How can we gain immunity and have herd immunity? And will it return at some point in the future? We don't have good answers for all those questions, and that really has a big impact on business reopenings and how the economy will come out of this. And that kind of leads into this next one here, the uncertainty on consumer behavior. Trying to understand and model consumer behavior is always fraught with uncertainty, but how quickly will consumers be comfortable getting back out there into large gatherings, on airplanes, bars and restaurants, theme parks and resorts, casinos, etc.? And at workspaces, there's been a lot of changes that we've already seen in shopping habits and work habits and commuting and investing and using technology and how energy is consumed and on and on. So a lot of uncertainty around where that's going to lead. And then on business reopenings, there's going to be new capacities, new arrangements to enter establishments and lines that you have to maybe follow, new rules, and many consumers may or may not want to follow a lot of the new rules that the businesses are going to be putting in place. And then finally, we have a lot of uncertainty on policy. Fiscal policy and monetary policy are the, generally what I'm talking about here, but also the responses and the implications of policies that are already put into place. So will there be more policy responses coming out of Congress and the Fed? And what about the potential unintended consequences of some of the current policies already in place? So for example, and I think I mentioned this on the last call, we've already heard some concerns about trying to get workers back to work if they're getting a big boost in their current unemployment benefits. So let's take a look at some of the uncertainty on some of these things here. This is the virus. This is daily COVID-19 cases. And the question is it leveling off? Has it plateaued? It appears, that it's come down off of some of the larger peaks, but it also appears that maybe it's been flat as of recently. And, given the fact that more people are getting out and about more, those cases start to rise again. Does weather have something to do with it? I don't know. So something to keep an eye on. As far as where people are, I found this fascinating chart here from Google. They look at, they're basically tracking you, yes. And if you go back to February and March, early March, you can see where it was rather stable. And then all of a sudden, we quit going to retail, recreation, transit stations, and our workplaces, and we started going to the grocery much more, stocking up on things. And then the yellow line is residences. We started staying home a lot more than we have. But now you look at it and you can see we're still avoiding transit stations in the workplace. We're starting to come back more on the retail, recreation, and grocery and pharmacy is right back to where it was previously before COVID. We are staying home more. I mean, it's working at home more primarily, and getting back outside into some of the parks. So that's interesting. What about restaurants? This is from Open Table that takes reservations, and they fell off the cliff, 100% decline. This happened around the world, by the way. You can look this up for different countries and different states. And so I just took the overall US number, and we're still down about 75% of where we were on a year-over-year basis. But it is improving rather slowly. Transit is not, whoops, I got my air travel here first. Air travel is also returning slowly. These are 2019 numbers through the TSA checkpoints for air travel. And you can see how the 2020 numbers also almost went to zero. But since early May, there's been a slight pickup, but still down, to 20% of what it was previously. And here's the transit. It's still seen as a poor mobility option. This is got the day of the week up and downs in there, but driving is pretty much back to where it was previously, and so is walking. The point, the index point here is January 13th, so everything is indexed to that. But transit remains a problematic area. People don't want to go there. All right, so on policy, I just wanted to show that the Fed's balance sheet has ballooned in the last few months. We were at about 4.1 trillion prior to this COVID crisis, and it has exploded up to about 7.1 trillion. So 3 trillion extra dollars from the Federal Reserve. You got 2.5 trillion that came in from the federal government. Not all of it is in the economy yet, but a lot of support and a lot of money that has come in to the economy. And so what are a couple of the key indicators I'm looking at to see whether or not we get back on track? First of all, I've got here the daily index of consumer sentiment. I've shown this one before, and I just wanted to show it again to show that, it seems to have bottomed out there in the low 80s. It has now come back to almost 90 on a 7-day moving average. Things will not be normal, if you will, probably until this thing gets back to about 105. So we still have a ways to go there. And we also have a ways to go on this other weekly economic index that the New York Fed puts out. And they update this twice a week, but it comes out once a week, every Tuesday and Thursday, I think is when it's updated. And this is showing that GDP on an annual basis right now is running at about -10 to a -11 percentage points down. So we're down that much in growth and contracting. So these are two of the main kind of more what I call high frequency indicators that I'll be keeping an eye on. And so that's kind of my wrap up on what's going on the economy. And so now I'd like to introduce Dan. Dan White is the Director of Government Consulting and Public Finance Research at Moody's Analytics. And in this role, he oversees economic research with an emphasis on fiscal policy and municipal markets, municipal market impacts. He is an adjunct professor of economics at Villanova University, and he holds an MA in economics and undergraduate degrees in finance and international business from New Mexico State University, where for the state of New Mexico, he was also a financial economist prior to his work at Moody. So we're really pleased to have Dan here. I've seen him give some presentations in the past, and he's got a lot of great information. So Dan, we're glad to have you here, and I look forward to seeing what you have to say.
Awesome. Thanks so much, Tom. I'm going to, that was a really great introduction, by the way, because I can just skip all the economic bits now and just go on right to the state fiscal stuff. So I appreciate you guys having me here today. I'm going to talk to you about 20 minutes or so to give you guys plenty of time to ask questions about kind of what you've seen here and kind of what you saw in Tom's presentation. Before I speak, though, and, some of you may have seen me speak before. You'll know that I have to give a bit of a disclaimer. So I work for Moody's Analytics, which is an entirely separate company from Moody's Investor Service. So I have to ask to please not take anything that I say today as having any bearing on past, current, or future ratings actions. If that sounds like it was written by a lawyer, it's because it was, but it keeps me out of trouble, which is always good when you're given a talk like this. So I'm here to talk to you really about the economy, and specifically what Tom asked me to speak to you about is kind of how the economy is impacting state and local governments right now, and kind of in turn how what state and local government policy responses will be kind of impacts the economic recovery going forward. So we'll talk about that. Before I get too far into this, I do want to say that the stress tests that I'm about to talk to you about are something that we've been doing at Moody's Analytics for the better part of 7 or 8 years now. And the one that I'm going to present now, the findings are from about a month and a half ago. So the economic scenarios that I talk about are not necessarily equivalent to what our baseline scenario is right now, but I will try to give you some context about what the baseline looks like relative to these two scenarios to give you some context around what the actual numbers might be. Okay, so let's talk about the economic scenarios first. I can have movement here. Well, just a second when I can control, there we go. Talking about the two economic scenarios. There's a moderate stress scenario that we put the economy through, or state government budgets through, and there's a severe stress scenario that we put state government budgets through. Now, we did this based on what our economic outlook was in the beginning of May, the end of April. And it really gave us some good kind of benchmarks around what the potential impacts on states could be, because you've seen a lot of policy discussions going on around state and local governments right now. Majority of them have come out since the House just released their HEROES Act a few weeks ago, with really some astronomical numbers in it. $1 trillion in aid has been proposed to state and local governments. And so hopefully this gives you some context around those discussions and kind of what we think the real number probably should be. So under our moderate stress scenario, think of this as more or less what our baseline was. It's hard to say that a moderate stress scenario is the baseline, but this is more or less what our baseline was at the end of April. It was a very deep recession in the first half of 2020, followed by a modest rebound, really dependent on the timing of when a lot of the business restrictions and travel restrictions were in place. We now know, obviously, that it may be a very long time before all of those restrictions are fully repealed. But in terms of getting to the new normal, it really made the assumption that we get to whatever that new normal is kind of by the end of June and the end of the second quarter. Now, that is equivalent to a peak jobless rate of about 13%. Now, keep in mind that that's the average over the course of the quarter. So the actual peak jobless rate is going to be higher than that in 1 or 2 months. We've probably already seen kind of the peak jobless rate if you look at some of the labor market impacts, depending on kind of some of the uncertainty around the BLS numbers that we're seeing right now. And it's a peak to trough real GDP decline of about 10%. So if you look at the numbers that Tom just showed you, where it showed the real GDP decline on the daily Fed survey, we're right now at about 11 or 12%. So the actual kind of baseline that we're following right now is probably much closer to the severe stress scenario that I'm going to present to you as well. Now, this assumes the travel and business restrictions last well into the third quarter, which in some states it looks like that's definitely going to be the case. That delayed recovery is going to cause a lot more long-term disruptions to the economy, and so the shape of that recovery is a little bit different. It's much more severe. We see a peak jobless rate of about 17%, again, average over the quarter, and a peak to trough real GDP decline of 14%. Now, to put that in context for you, during the Great Recession, we saw a peak to trough real GDP decline of about 4%. So we're looking at more than triple the amount of economic impact that happened during the Great Recession. So really, these are not stress scenarios that we had ever intended to put through our state budget stress tests, and it's really amazing to see some of the results that we've gotten out of them. So how do we stress test states, and why do we stress test states? Well, the first thing, we stress test states because what states and local governments do has a tremendous impact on the economy, okay? So state budget responses are a big reason why the Great Recession was followed by the not-so-great recovery. So even though it was the longest period of expansion in American history, it was a very sluggish recovery, especially in the first 3 or 4 years afterwards. A big reason for that is that states in particular, but also local governments, were unprepared for really any recession in 2008, let alone one the magnitude of the Great Recession. And as a result, they were forced to make some very difficult fiscal changes in terms of cutting spending, in terms of raising taxes, and that had major implications for the economic recovery afterwards. A lot of people kind of call state and local governments almost an economic amplifier. So they amplify the effects of whatever's going on in the business cycle when things are really bad, even though everything else is turning down and the federal government might be pouring more money into the economy. Because state and local governments have a zero-sum game in terms of their budget, they have balanced budget requirements, they can really amplify the impact of that because they can be acting in kind of a contractionary fiscal policy at precisely the worst time to be acting in a contractionary fiscal policy. And that's exactly what we're seeing now, and some of the implications for these stress tests are why we look at that, to see kind of what the impact will be on the eventual economic recovery and how big of a drag potentially will states and local governments be on that recovery. Now, we do this by taking several models that we have in-house. We have 50 state tax revenue model that we run, and we look at the change in tax revenues over time. That's usually what most people think of when they think about a recession in state and local government budgets. They think of tax revenues declining. There not being enough money to pay for the basic levels of services, and so there's cuts or there's tax increases, which obviously have an economic impact. Now, the one thing that most states have in common, and that most people don't realize when we look at the recessionary impacts of the state, is it's not all on the revenue side, okay? when we have a recession, it impacts not only state revenues, but also state spending as well. So actually the first place that we look when we stress test states is we actually look on the spending side. Specifically, we look at Medicaid rolls. Now, Medicaid rolls are more important today than they've really ever been in the life of state budgets because they make up a much larger portion of overall state budgets than they ever have. So if you were to go back to, 30 plus years ago, 1985, states spent about 9% or so of their overall budgets on Medicaid. Today, there are some states that spend more than 30% of their budgets on Medicaid. So this really has a tremendous impact in terms of the business cycle, and it's one of the reasons why states were relatively unprepared in 2008 was because they had never seen a recession really impact the spending side of their budgets in the same way that they did in the Great Recession. Well, this is the Great Recession on steroids in terms of the impact on Medicaid because so many people are losing jobs, so many people are losing access to their health care, and so they're falling into their Medicaid rolls, especially in states that have expanded their Medicaid programs as a result of the Affordable Care Act. There are a lot more folks in individual states who are now eligible to go on to Medicaid, not just because they've lost a job, but maybe they've lost some hours or they've been furloughed for a certain period of time. Medicaid is a much more reasonable option for them now than it used to be. And the result of that is that we see huge increases in spending whenever we have an economic downturn. And if you go back to the Great Recession, if you remember, started in December of 2007, based on the NBER that Tom talked about earlier. I can remember being an economist in the state of New Mexico and doing tax forecasts in the summer of 2008. I remember, I'll never forget it, in July of 2008, we did a tax forecast, and it was the day that oil prices hit $142 a barrel, which seems almost laughable in today's current environment. But I remember $142 a barrel, and that morning, Goldman Sachs released a report that said that oil prices were going to be $200 a barrel by the end of the year. And so we, being the very conservative economists that we were, thought we were being very safe by projecting that oil prices would basically stay flat for the rest of the year, and that state revenues would only increase by a little bit. And I can remember still, and I won't say which legislators did it, but just being screamed at in a back room at the legislature because we were being too conservative with the economic outlook. Well, that was in July of that year. In August, we gave out tax rebates to everybody in the state of New Mexico, and we weren't alone. There were states all over the country who were doing that same thing at the exact same time. And it wasn't until September of 2008 that when Lehman Brothers went under, that everybody kind of said, okay, hang on a minute, there really something is wrong here. And then we had two special sessions to, basically cut all the money that we had just given back in terms of tax rebates. Now, I want to stop right there and think about the timing of all that, right? So we're doing the revenue forecast in July. We are giving out tax rebates in August, and it's not till September that we realize something's wrong when the stock market blows up. But if you look at the NBER, which Tom was talking about earlier, the NBER said that the recession started in December of 2007. So we are 9 months into a recession, and we are giving out tax rebates. We're projecting $142 a barrel oil. It can be a while before most economists, and especially if you look only at the revenues, it can be a while before state policymakers realize that they're in a recession. But if you go back and you look at the data from that time, there's at least one person in every state who knew or should have known that we were in a recession 6-7 months earlier than that. And that's the state Medicaid director, because state Medicaid spending increased by 25% in the first quarter of 2008. And that should have been a dead giveaway to everyone in every state that, something's wrong here. People are losing their jobs. People are going on the Medicaid rolls. But because incomes were rising so quickly and because jobs really hadn't started to fall off too far yet, revenues didn't fall until really the end of 2008. And so if you look just at the revenue picture, it can really give you a distorted view of what fiscal pressures are coming onto states. When we look forward to the next recession, we can see right on cue in the first quarter of 2020, an enormous increase in Medicaid spending, right? So this is our projection. So you see the moderate and the severe numbers here. The peak of the Great Recession, so the most people who were unemployed in the Great Recession at one time was about 15 million people, right? So we have easily surpassed that, and right now we think we're somewhere around 30 million people who are unemployed in the United States. Even if we get rid of half of those in the next 2 months, say the recession's over today, we'll get rid of half of those in the next 2 months, we're still basically at peak Great Recession levels of unemployment for the next 4 to 6 quarters as those jobs are slowly digested back into the economy, which means that there's going to be a heck of a lot of people on state Medicaid rolls. There's going to be a heck of a lot of people on unemployment insurance, a lot of people partaking in social services spending from both the federal government and state and local governments, and that's going to come at a tremendous cost. Now, the federal government, they can turn around and they can issue treasury bills and borrow to cover that, but states and local governments can't. And so every dollar that we're spending on Medicaid, every new dollar, is a dollar that we have to take from somewhere else in the budget. So it either has to come from a revenue increase, or it has to come from education or public safety or any of the other very important services that states are paying for. And this is the first piece of stress that states are going to feel, because it's going to happen immediately as people start to call on the Medicaid rolls. Okay? So that's step number one in terms of the process. Step number two is we look at revenues. Now, when we looked at revenues in the Great Recession, we saw overall state revenues fall by about 11 or 12%. So when we've gone through and we've re-stress states in terms of our stress testing exercises, what we found is that the average state probably needs about 11 or 12% put aside in a rainy day fund in order to get through a moderate recession, a normal recession in good shape, right? Now, this isn't a normal recession, okay? And the other thing that we found through years of stress testing is there's no such thing as the normal state, right? There's no such thing as an average state. The distribution around that average state is so enormous. It really is incredible. So this is a look at all of the different states. This is the distribution of potential outcomes for revenues over the next year and a half or so. So this is the revenue loss compared to what would have happened just with inflation. So take 2019 revenues and just grow them out by inflation through fiscal 2021. And this is the loss or the difference that states are going to see relative to those numbers. And they range, you know, your energy states, Alaska, Louisiana, North Dakota, they have a tremendous amount of money in the oil patch. And so they're going to see revenues fall like a stone. And you know what? That's something that's okay for them because they've seen this movie before. They know how it ends, and they're usually pretty well prepared for it. When we look at some of the state preparedness measures here in a couple of minutes, you'll see that those states are actually going to be in pretty good shape. The states who are not going to be in so great a shape are states like New Jersey, you can see on this list here, Louisiana, New York, states who are not very well prepared for a downturn of this magnitude, who, because of the way that COVID has unfolded in terms of a recession, is really going to have a tremendous impact on those states. Now, there are some states here who are not going to see as much of an effect in terms of their tax revenues. Generally, the states who do the worst with regard to their tax revenues are states who have been especially impacted by COVID. So Louisiana, New Jersey, New York are great examples. There are also states who either rely on energy or they have very volatile industrial structures in their states. So states that rely a lot on tourism, for example. So states like Nevada or Florida will see a higher than average reduction here. But then also some states will see it based on their tax structure. So a state like New Jersey, for example, New Jersey has a tremendously progressive personal income tax that they rely on. Now, that's not necessarily a bad thing from a tax policy perspective, but in terms of a budget policy perspective, it introduces a tremendous amount of volatility into the business cycle because you're relying on a very small number of taxpayers at the very high end of the income bracket who have very volatile revenues from one year to the next. Yes, you know, the 1%, if you rely on them to pay for tax revenues, you'll make a lot of money over the long term, but from one year to the next, they can make 12 million one year and they can lose 12 million the next, and they can oftentimes carry over some of those losses for several years and can really have an impact on your income tax returns when we have a change in the business cycle like this. The states who see the smallest impacts are states who have relatively stable economic mixes. So, you know, Pennsylvania is eds and meds. So even if there is a reckoning in terms of healthcare and higher education, it might take a while for that to really flow through to the job market. Maryland's also very similar. South Dakota, you know, very stable economies kind of working on this. The other thing that these states have in common, and I'll pick on Pennsylvania because I'm a taxpayer in Pennsylvania, so I have the right to pick on them whenever I'd like to. We have a very flat personal income tax in Pennsylvania, which is, during a business cycle, actually a very good thing because it's kind of the opposite of the New Jersey example that I gave earlier. It affords you tremendous stability from one year to the next. You don't see nearly as much of a roller coaster ride in terms of your overall tax revenues. And so you don't see the huge upsides when we have an economic expansion, but you also don't see the huge crash when we have an economic recession like we're seeing now, which is why the fiscal impacts in Pennsylvania, for example, are much lower than elsewhere. Okay? Now, have I sufficiently bummed you all out about kind of the impact of all this? If not, I'm going to try and cheer you up a little bit for those of you who are a little upset. The first thing is that states are better prepared than they've ever been. So that's the first takeaway we should have. So even though those levels of stress are coming, state preparedness for that stress, they've never been as good as they are right now. And I think I would chalk a lot of that up to stress testing exercises like I just talked about. We're seeing a tremendous amount of states who are actually taking that stress testing process and they're incorporating it into their own budget process. And that's huge in terms of making sure that you have enough money put aside for a rainy day. Rainy day fund balances, as you can see in 2008, the average state had about 5% of its budget put away in a rainy day reserve fund. If you ask the average state why they had 5%, they can't answer. As a matter of fact, I remember going to National Association of State Budget Officers meeting and talking to all the state budgeters officers and asking them, why 5%? Because it was eerie how every one of them had exactly 5%, and nobody was able to give me a straight answer until one person who had been there quite a while said, well, I remember being in a NASBO meeting in 1977, and we had somebody from S&P, the ratings agency, come, and we asked them how much we should have in a rainy day reserve fund, and they said 5%, right? 77 to 2007, 30 years, nobody thought to question that or really challenge that or ask, why do we have 5%? Should we have more money put away for a reserve? And 5% might have been, more than enough for 1977, but it definitely wasn't enough for 2007. So what we see now for state budget processes is they are taking a much more proactive view at how much money they need to have put away for a rainy day reserve. And they are doing that. And you can see the difference in the rainy day fund balances. Rainy day fund balances were almost 8% at the end of fiscal 2019. And the total balances were over 10%, which is great for a normal recession, because a normal recession is going to take about 11 or 12%. But as you may have just noticed from me telling you, this is not a normal recession. And so even with this huge level of preparedness, states are going to see just a tremendous amount of fiscal stress come out of this. So if I take the results of the Medicaid forecast and the revenue forecast that I just talked about for the moderate and the severe scenario, and keeping in mind that the baseline today is probably much closer to the severe number than the moderate number, we see that states are just set for unprecedented levels of fiscal stress. So the average state, in order to get through a moderate level of fiscal shock, the moderate scenario, would need about 18% of their budget put away in a rainy day reserve fund, okay? To get through the severe stress, they need about 23% put away in a rainy day reserve fund. And keep in mind, too, that is just to get through the end of fiscal 2021, so the fiscal year that most states will be starting next month. Once we get to fiscal 2022, that number might be even higher than that. When we look at that in terms of the overall fiscal shock versus the level of reserves that states have to kind of absorb all of that shock, there are some encouraging stories here. So mostly in the energy states, we've got 5 states that have the reserves that they need to absorb the severe levels of stress that are projected in the severe scenario, okay? We've got 11 states who have most of the reserves. So they're within 5% of 5 or 10% of where they need to be. So if they don't get any help from the federal government, they basically have to cut spending or raise taxes by 5 to 10% of their budget in order to get through to the next fiscal year, right? But there are an unprecedented 34 states who would see budget gaps of 10% or more, even if they took all of the reserves that they have on hand and plowed them into the budget holes, right? So 34 states are going to have to cut more than 10% of their budget. And some of those state numbers are even higher than that. So Louisiana, for example, you may wonder why There's some of the senators and Congress folks from Louisiana have been leading the charge in Congress to get some more aid to states. The reason is Louisiana could have to cut more than 35% of its budget if we don't see any additional aid from states. And when you talk about cutting 35% of your budget, that's so far beyond layoffs and furloughs. That's changing how you deliver basic government services. That's just a huge adjustment to make all in 1 year, and to make it all in 1 year with full level of reserves. But if we're going to see here in a second, the average state is not able to use 100% of its reserves all in one fiscal year. So the actual numbers are actually potentially larger than this. To give you some hint about kind of what they have right now to work with in terms of buffeting against this impact, I want to walk you through just kind of what the severe scenario looks like. So under the severe scenario, we expect the economic impacts through fiscal 2021 to be about $203 billion. So that's increased Medicaid spending and decreased revenues coming in relative to just kind of baseline keeping the lights on, no increase in spending. We expect there to be about $150 billion in terms of direct costs from COVID. So this is ventilators, this is overtime for emergency personnel. This is a very loose estimate right now. We're kind of taking this seems to be changing every day. We talk to experts in the field, a lot of our clients who are giving us feedback in terms of this number. It's very fluid in terms of what we hear from one day to the next, but our best bet is about $150 billion just at the state level. So this doesn't include a lot of the local government stuff as well. In terms of the resources that states have to offset this, so that's a $350 billion need. In terms of usable resources, they've got their own reserves. So there's about $72 billion in rainy day reserve funds sitting out there among states. If we assume that states can use about half of those, which I think is a generous assumption, that's about $36 billion that they have to draw on to offset, avoid trying to cut spending. We see about $110 billion from the CARES Act. Now, the CARES Act actually appropriated $150 billion to states and local governments, but based on our calculations, we assume about $40 billion of that will go to local governments, so cities, counties, those kind of folks, and only about $110 billion of that will go to the state level. And keep in mind, too, that $110 billion from CARES is specifically earmarked for COVID-19 specific spending. So just the light blue bar that I have up top, it can't be used to offset the economic impacts from higher Medicaid or lower revenues. The Family First Act, which was actually the second of the three stimulus bills that was passed, did include some extra money for states in terms of Medicaid spending. Our estimates are that gets about $35 billion in increased spending, which is almost enough to cover a lot of the Medicaid hit that folks are going to have. But it's actually significantly less than states would have received during the Great Recession. And so I would expect that any additional federal stimulus to states and local governments is going to include quite a bit more Medicaid spending in terms of the impact there. So if we kind of net those two out, we get an estimated shortfall of about $172 billion. Given some of the uncertainties around the COVID-19 spending and some of the Medicaid issues, I think it's safe to say that overall need comes to about $200 billion through the end of next fiscal year, so fiscal 2021. If we were to go out an additional year beyond that, so fiscal 2022, you're looking at $100 billion plus in additional need, especially in terms of the revenue impacts. We're actually in the process of updating these numbers now based on our most up-to-date revenue forecast, and that's a pretty safe bet. So you're probably looking at somewhere in the $300 to $350 billion range for state budget needs over the next two fiscal years that without additional federal help is going to have to come directly out of the bottom line of state budgets. So if we have to take $350 billion out of state budgets, it's going to come by way of aid to local governments. It's going to come by way of support to higher education. It's going to come by way of layoffs and furloughs. It's going to have a tremendous economic impact when we look at this. The other piece it's going to have in terms of not just the economic impact, but there's a credit impact there as well. The first place that states like to look at, again, is local governments, because local governments can raise their own taxes. We are very much on the lookout for potential cuts to local government aid as a result of this. And that could lead to a tremendous increase in the number of defaults or bankruptcies that we see as a result of this recession versus, say, the Great Recession, for example. And that's saying something because local governments in particular have been much more adept at navigating defaults or bankruptcy than they've been in the past. If you look at, for example, just the Moody's Investor Service rated universe, and remember, I'm not part of the ratings agency, I'm kind of an outsider looking in here. But if you look just at that universe of data, there were only 5 general government defaults between 1970 and 2007, okay? Since 2007, there have been 24 general government defaults in the Moody's rated universe. And we're seeing those numbers grow and grow. So as local governments become more comfortable with default or bankruptcy and they see that it's a viable option, especially in such an extreme time as this, it's very likely that we see more local governments, school districts, et cetera, opt for that default or bankruptcy solution if they don't get the kind of aid that they need from the federal government or state governments getting out of this. And that really puts state governments in a squeeze because then they've got to take it out of their own workforces, and we're seeing that they're already starting to do that. So if we look at the jobs data, just in the last 2 months, we've lost basically 2 decades worth of job growth in the state and local government sector, okay? 1.5 million folks have been either furloughed or laid off in state and local governments in the last 2 months. For context, the last time that we had that few state and local government employees in the United States was before 9/11. Okay, so if that streak was a person, he could almost be drinking by now. That's how long it's been since we've had that many or that few folks working in states and local governments. Now, what you'll notice from our time after the last recession, to the Great Recession, is that it took us a heck of a long time. As a matter of fact, it was only in the last few months that we actually recovered all of the jobs that we lost following the Great Recession. And it might take an equally long time for us to regain all of the jobs that we're losing in terms of the COVID-19 recession. The only upside that I see to a lot of this is that if you look at the jobs data, so out of the 1.5 million jobs that have been lost, about half of those, so about 750,000, have come from local government education. And most of those may come back online very quickly because of union protections and because of the way that they were really shut down at the end of April hard. If they're allowed to do in-person instruction in the fall, then a lot of those jobs might come back very quickly. However, the majority of those jobs are not going to come back, at least not very soon, because local government property taxes really haven't been hit yet. They're going to start to be hit over the next year, year and a half. If you look at the very large states and local governments who rely a lot on personal income taxes, those really haven't been hit very hard yet. They'll start to be hit at the end of this year, early next year. And so the recovery in state and local government employment hasn't begun, and it's not going to be finished for probably 7 or 8 years following this under best case assumptions. It might take a full decade like it did after the Great Recession, in which case a huge chunk of the middle income of the middle income core of the job market might be under a lot of stress for the next 6 or 7 years. And that's going to have tremendous economic consequences when we look at the growth, the potential for economic growth over the next 7 or 8 years. Our best estimates show that if the federal government doesn't step in and give at least $500-600 billion in aid to state and local governments very quickly, that the economic fallout from that could be somewhere in the 3 to 4 percentage points of GDP. Again, remember, the Great Recession was 4 percentage points of GDP all by itself. So we're looking at another Great Recession just from the impact of these cuts. And you're looking at somewhere around 3 million jobs that go away as a result of these cuts when you look at the direct job cuts and some of the multiplier effects that come along with that. So it's one of the reasons why I think a lot of folks are very rightfully advocating for a lot of aid to states and local governments going forward. And even with that aid, there's a lot of states that might be having to make some very difficult fiscal decisions over the next year to year and a half. And now that I have sufficiently bummed everybody out, Tom, I would love to take any questions from folks on this or anything in terms of the broad economic outlook. Or Katie, I suppose I should turn it over to you as well, right?
Yeah, thanks, Dan. Yeah, that's, it's certainly humbling and depressing in many ways. But, it's something we need to look at and look at going forward. So I'm sure Katie's got a few questions in there. If she doesn't,
We actually don't have any questions yet, so please feel free to put your questions in the chat, or if you would like to unmute your line and ask a question, that is totally fine as well.
So I got just a couple, just until we get some online there. First of all, I know that some states are, worse off and better off when it comes to how much Medicaid, responsibility, I guess, that they have. And so I was wondering if you can just kind of talk a little bit about, what are some of those better states, worse states. But also I'm curious about the revenue sources, the taxes that come in. There are income taxes, sales taxes, property taxes, lottery taxes, other kinds of taxes. Is there a better tax model that some states will be able to get through, or is that not going to matter too much?
Two good questions. So from a Medicaid standpoint, you're right. So what states get, Medicaid, for those of you who are not super familiar with Medicaid is basically health care for lower income individuals. And it's jointly funded by states and the federal government. So what happens is the states actually outlay all the money up front, and then they get a matching percentage paid back by the federal government. It's called an FMAP, or Federal Medical Assistance Percentage. Now, the FMAP is set by the federal government based on the underlying poverty rate within the state itself in the preceding 3 fiscal years. And what they do is, if you're an exceptionally poor state, you get more federal money. If you are a less or more wealthy state, you get less federal money. Kind of throwing a monkey wrench in that a little bit is the fact that under the Affordable Care Act expansion, some states are actually getting a lot of additional funding from the federal government. So the average match in some of those states can be as high as 83% or so. The bottom line is, if your state opted into the Affordable Care Act, then you're probably seeing faster Medicaid growth over time, but you're seeing less volatility around the business cycle, because a lot of the people who kind of ebb and flow onto and off of Medicaid during a business cycle are probably already on Medicaid in your state, right? But if you're a state that hasn't opted into the Affordable Care Act expansion, you're probably seeing slower growth in Medicaid, which is a good thing, over time. But when we go into a business cycle, you're going to see a lot more volatility and a lot more impact on your budget, because there's a lot more folks who can, again, ebb and flow onto and off of Medicaid based on what their employment situation looks like. That's, I think, the biggest key to be watching out for when you're looking at state-by-state comparisons of Medicaid. There's also some programs in some states that are much more generous than others, or some states that spend a lot more because of their demographics. So not just in terms of poverty, but in terms of if a lot of elderly or a lot of senior residents in their states. Again, I'll pick on the Commonwealth of Pennsylvania. We actually spend more in Pennsylvania on Medicaid than any other state. Even though we're a relatively wealthy state, we've got a lot of folks who are dual eligible on Medicaid and Medicare, and who are being paid for both ways that way. And so we spend a lot of money. But it's a really important thing to watch, not only as we enter into hopefully this next phase of stimulus, but in terms of how that stimulus wears off over time. It'll be important to see how states kind of react to that. In terms of the revenue question that you asked, there is no one-size-fits-all revenue structure that fits for states. It really is a combination of the revenue structure with the underlying economic structure, right? So in a state like Alaska, it makes a lot of sense to rely a lot on severance taxes because there's so much oil there and there's so few people. But in a state like New York and New Jersey, it might be a lot more advantageous for them to rely on personal income taxes. The biggest issue, though, around the revenues is to make sure that you're budgeting according to whatever your industrial and your tax mix is. One of the reasons that states ran into trouble in 2008, and if you look at the states that really got in trouble, it wasn't the energy states, even though they saw the biggest impacts in terms of their budget. They've seen this movie before. They know how it ends. They've got big rainy day reserve funds, and they budget accordingly. In 2008, the states that really got hurt were the states who like California or New York have tremendous volatility because of these very progressive personal income taxes, but they had never budgeted for those kind of swings before, and so they really got hit. A good example to look at is look at the juxtaposition between California and New York. Both of them were hit about equally bad in 2007, 2008 as a result of the Great Recession. But since then, California has done a tremendous work in terms of building up its rainy day reserve fund. And so if you look at it in terms of preparedness and the fiscal impact and the economic impact that'll happen because of this, it is, night and day better off than New York will be, because New York hasn't spent much time in the last 10 years increasing those rainy day funds and preparing for this next downturn.
All right, thank you, Dan. So I have a few questions now in the chat. So the first one is, what do you see as the impact of PPP on employment?
So
well,
that's interesting. Dan, I don't know if you happened to see the analysis that came out this morning from one of your colleagues, Bernard Garros. It had a little emphasis on that. So can you talk about that and maybe tell us how it might impact the states a little bit, differently?
Yeah, Bernard does a fantastic job. He really follows a lot of our federal stuff. And what we've seen so far is that the job impacts have been very good as a result of PPP. However, it's the timing of PPP that really matters, and whether or not we get another extension of PPP will be really important. We're running low on time, so I'd invite people to read Bernard's piece in more detail. But the timing and kind of the uncertainty, as you talked about, Tom, going forward of what that program looks like going forward and what qualifies is going to be very important in terms of the economic outlook, especially over the next few months.
Yeah, so the next question we have, what do you make of the Fed's announcement today that it projects no rate increases through 2022?
Well, it's kind of been expected. I mean, I don't think anybody expected the Fed to come out and say they were going to be hawkish by any means, but it does have some downstream impacts. And Tom, you and I were talking about this earlier today with some of the bank deposit forecasts, which I know is important for most of you. With rates staying that low for that long, and not only that, but being telegraphed to stay that low for that long, it really does have the potential to push down bank balances over the next several quarters or several years, especially when we look at some of the more extreme scenarios that we talked about. So the severe recession scenario, or S4 or S3, if you're familiar with our numbers. Those really see very sluggish growth, if not full out contraction in some of the bank balances as a result of that. I think in terms of the equity markets, though, and consumer confidence, I think it's going to give folks a lot of confidence knowing that the Fed is really trying to telegraph that as much as they can. But at this point, the Fed's done about as much as they're able to do. I think anything beyond this, from a policy perspective, really falls to the other side of Pennsylvania Avenue and the folks on Capitol Hill.
Yeah, I'd agree. I mean, I think the Fed has really kind of pulled out all the bazookas, and they're claiming they still have some more if needed. I do think that they're telegraphing that is to look at, their forward guidance now is going to be kind of a time dependent thing, and trying to telegraph that we're going to stick to this. But being a 33-year Fed man, I was there for, I guess, a third of the Fed's existence almost. They're data dependent, and if things change, they'll change to go along with that. So if there's a robust economy, then they'll start raising rates earlier. You could read that the Fed thinks the economy is going to really be sluggish for a long period of time, and that's why they're not going to raise rates.
Mm-hmm.
All right, so the next question we have is, what do you think the likelihood that the states will get the gap funding they need from fiscal stimulus from the federal government?
I think it's very strong likelihood that they get the funding they need from the federal government. I think the bigger question is about timing. They need this funding like yesterday, or they need at least some inkling of how much they were going to get yesterday. So just for some timing, most states are right now, they're trying to figure out how they're going to close their fiscal 2020 budgets, which end in 20 days for most states. They haven't even been able to think about fiscal 2021 yet, which for most of them, they're going to have to go back in August or September, and they're going to have special sessions and reassess how they're going to balance their budget in fiscal 2021 and really look forward to setting themselves up for success in fiscal 2022. If we get to August, which is the congressional recess, and we don't have any bill that says we're going to give X amount of money to states and this is how we're going to do it, state policymakers are going to have to be exceptionally cautious when they're putting together those 21 and 22 spending plans over the next few months. That means that the cuts are going to be larger, that the potential revenue increases are going to be larger, and the economic impact is going to be much heavier over the next 6 to 12 months while Congress potentially gets that together. So the sooner that Congress can get that money, and again, I don't think they need the full, $1 trillion in the HEROES Act, but probably somewhere around $500 billion. The sooner they can get that done, the better off the economy is going to be and the better off state governments are going to be.
So we have about 3 minutes left and 2 more questions. So the first one, how is the Fed Municipal Liquidity Facility going to improve the ability of state and local governments to manage cash flow?
I'll try and be as quick as possible so we can get to them both. The MLF facility, it's helpful for a lot of governments. It's not helpful for most governments. So it's going to help the largest folks with cash flow. It's going to help the lenders of last resort. But a lot of the folks who really need that liquidity are folks who are not big enough to qualify for MLF, or they're not highly rated enough to qualify for MLF. And so while I think it's going to, it's definitely going to improve things, it's not going to improve things where we need the improvement most, which really worries me. But to Tom's point, it's not the Fed's job to do a lot of this. This is something that really has to be taken care of with Congress. And if they can get that aid out more quickly, then there's a potential that a lot of those weak points get picked up.
Last question, what do you expect the impact to be on unfunded pension liabilities?
Oh, well, they're going to go up. That's no question about that. I don't think that any aid that we get from Congress, I think the Senate's been very clear that they're not going to approve any funds that go out the door for unfunded pension liabilities. But to their, it's kind of a moot point, because in the states where it really matters, so your Pennsylvanias and Illinois and Kentuckys, those balances are so large that even if you took all of the money you're going to get from COVID relief and threw it at your unfunded pension liability, it wouldn't make a dent. So what we're going to see when states have to cut spending is they're going to look for any place that they can cut for cash flow. And one of the places that they can cut is on unfunded, or they can short their pension payments or put them off for several years. And so all states kind of as a whole will probably see their unfunded liabilities increase as a result of this. It's important to keep an eye on those states who are in most trouble, Illinois especially. They may not be able to short them much longer because of how close they are to solvency issues.
Great. Well,
Did we get on time?
Yes, we were right at 4 o'clock, so perfect timing. I want to give a huge thank you to both Dan and Tom for their time today. I will be sending an email out with the recording as well as a copy of both of their slides. So keep a lookout for that. And thank you so much and have a great day, everyone.
Thanks. And thank you, Dan.
Thanks, guys.
Katie.
Appreciate it.